Hi, I'm Dr. Margriet Barnard, your host of the Birth and Baby Show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms, midwives, and birth workers to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust.
This episode is brought to you by Simplex, who has been one of the market leaders for more than 2 decades, providing quality products at an affordable price, trusted by moms and midwives alike. Visit simplex.co.za for a healthier way of life.
Hi and welcome back to another episode on the Birth and Baby Show. And for today's episode, I have a wonderful guest that has become a friend of mine. We've professionally crossed paths, and her name is Janae. And you will know why I say you are in for a treat, because she's got a wealth of information and knowledge and wisdom. She's lived it through. We're going to be talking about antenatal education and more specifically a little bit about hypnobirthing and demystifying that term. So welcome, Janae. She's here with me in the studio.
Hi, thank you, Margriet. Thank you very much for welcoming me into this beautiful studio.
Yeah, it's exciting to have you, and we can talk for hours, but we have limited time, so I'm going to dive in.
Absolutely.
Tell the people a little bit more about yourself, first and foremost.
So it was funny when you asked me to be on the podcast. I thought, there's so many stories I could tell, but I think for me, I feel very, very privileged. I grew up in a home where my mom's stories about birth were: you go into hospital, you have your baby, and you come home, and everything's great. And I really realized that wasn't the case for all women. And so I think for me, the reason antenatal classes are so important is we don't know what stories we're actually perpetuating out there. And so birth can be daunting. A lot of women are fearful of birth. But I think for me, I lived in the UK when I had both my children. I had my children at the ages of 40 and 42. So I think I was very privileged to be able to have home births with both of them. And that was really as a result of, I think in the UK we have a lot of midwife-led care. I think in South Africa it would have been a different story if I had my babies here. But that's what makes me so passionate, is I had such beautiful experiences. And often when I speak to people, they'll say to me, you're a freak of nature. And I can tell you, I don't even go to the hairdresser because it's too painful. So I really know that birth can be a magical event. And so that's why I met up with you, just loved what you did. And I was like, I need to be in this woman's life. So yeah, we need to spread the love.
Yes. So you, as I said, you worked it through with experience. You had your own beautiful home births on a more, they would say, it's advanced age.
Yes. Geriatric pregnancies, they call them. Yeah.
No, beautiful. So Janae, tell me, you've become very active in the birth world because of that. But how did that all happen then? That you actually became involved with childhood education?
Yeah, so it's a bit of a story. I was actually in a corporate job, feeling very stressed, as we all, are in a corporate environment. And I thought, if I'm going to maintain this, I need some sanity. So I booked on a self-hypnosis course, actually, just to cope with stress and anxiety. And the results that I saw there were just in a weekend. It was a Saturday and Sunday. And I was blown away, not just the results for myself, but there were actually 2 particular people. One chap had a fear of spiders, and he overcame it literally in 15 minutes. It was incredible. And the other lady was in her 40s, couldn't meet a man because she blushed so badly, and she couldn't even approach the opposite sex. And literally in 30 minutes, she wasn't blushing. And I was like, This is so powerful. Yes, it was incredible. And if this is so powerful, I've got to study this. So I basically wrote up for the full course, did the 2-year qualification to become a hypnotherapist. And then, I don't know, it just came over my path that so many women with postnatal depression came through the practice doors. And so that got me on this journey of, what is it that causes postnatal depression? It's great that we can treat it, but what could we do to prevent this? And the one golden thread through all of these birth experiences was they all described it as traumatic. No matter what happened in their birth, whether it was natural or cesarean, the one word that they all used was it was traumatic. And so for me it became really important to look at how can we prepare for birth better. In my mind, as I said, birth was, you go in, you have your baby and you come home, and it wasn't this dreaded thing. And yet for these women, they had had really traumatic experiences. So it got me on a journey of discovering what we call now hypnobirthing. And that was really about preparing women for birth. And this is why I feel so passionately about antenatal. It's something we don't talk about. People are like, oh, I'm pregnant, but I don't want to talk about the birth. I'll deal with it on the day. And actually, we can prepare ourselves for that. If I can have both my babies at home, in the water, and I don't even go to the hairdressers, I promise you, most women can do this. So Absolutely. If there's no medical reason why you can't, just preparing yourself, you can definitely do it. Yeah.
Wow, what a great story. Janelle, let's unpack it a little bit, because you say you were going to study this. What is this? What is that thing then?
Hypnotherapy is so vast. So it was that there's so much you can do with hypnotherapy, but for me it was understanding how our brains work and understanding that we're hardwired for certain things. And one thing is for sure, the only thing your body is ever trying to do is actually protect you and to keep you safe. And so if we can come from that space, it's really easier to understand that, for example, if your mother had a very traumatic birth experience with you, she would say things to you during your childhood, and those little drip feeding bits of information build your reference point then when you have your own babies. And so without even consciously knowing it, you're already fearful of birth.
Yeah.
And so understanding that we're hardwired that way, your subconscious mind takes in every bit of information. Even though consciously you're like, I'm going to do this and it's going to be okay, and da-da. Your unconscious mind, and I always liken it to an iceberg. If you think about an iceberg, the tip of the iceberg is your conscious mind. That's the bit that you kind of like, this is what's going to happen and this is how I'm going to do it. And then that bit under the water is every single experience we've ever had, everything we've ever heard is like this reference library of what actually is going to happen. And so preparing for birth is about, you don't have to unpack it all, but it's about just noticing, what experiences has my aunt had that she's told me about, or my friend, or my mom. And then just realizing that actually I can prepare my mind for a better birth experience. But it does take preparation, and it takes going to an antenatal class that provides some good quality information about what the birth process is about. The first thing I start off with when I do antenatals is your body is amazing. Women who are pregnant are superheroes, right? Your body's forming this entire human being. And what I find fascinating is that we then doubt that we can birth a baby through a canal that long. So that end bit is where we kind of lose the faith. But actually during your pregnancy, you're walking around, you're happy, baby's forming. Medically, we don't even understand everything about our physical bodies, and yet your body can do that, right? So, and then we doubt, this little pathway. And so it was just fascinating to me to really unpack this mind laws and how we think, and actually noticing that we can rewind that, we can unprogram ourselves, because birth is something that we are built to do. If your pregnancy is healthy, you could have a very healthy, normal birth. In fact, it can be magical. So,
absolutely.
Yeah.
No, you're talking my language completely.
Yeah.
That's totally, and I've seen it time and time again with journeying with couples
Yes.
and unpacking their fears, figuring out what their fears are and the blockages almost.
Yes.
And then getting to the place of really being excited for birth.
Yes.
I find the partners are also very crucial in that, because it's also in their minds and they need to support their wives or their partners.
Yes.
Yeah, beautiful, beautiful.
And I think, sorry Maria, just to interrupt, but I think you see the side of it, which is so beautiful, is that they can go from this place of feeling fearful, and when the partner's on board and you as the midwife are supporting them and they feel safe and they understand this process of birth and how their body just magically, these hormones are just there when they need them, and everything just flows, and it's like a harmonious symphony almost. You've seen that so many times, right? Because you play that integral part of that safety net for them. The birth experience is just so much more special and peaceful. And when you have a birth experience like that, the mums are so much more inclined to trust their instincts afterwards. Because you're not doubting. You know that your body has just performed this most amazing thing. Right?
Absolutely. Yeah, it's such a continuum. Like as you said, it starts in pregnancy, just trusting that and going with intuition. If you can get that right with birth too, it sets you up for motherhood so much. I see that it really grows confident mothers. Breastfeeding is also quite an intuitive process. You don't, all of those things. So yeah, it's really, really powerful. I am thinking of those births that it hasn't. There's sometimes women that have prepared very hard.
Yes.
I wonder in hypnobirthing and your understanding of the mind, if over preparation can sometimes also block a natural process.
Yeah, so there's a couple of things there, right? So we don't have complete control, right? So sometimes I think you have the birth experience that you actually need, in some cases, and then sometimes I think hypnobirthing can have a bit of a negative connotation, because if mums are only focused on, I'm going to have this blissful water birth, and then things don't go according to plan, it's almost so alien, that concept, to them, that they then completely freak out. And so having to go for a cesarean is so traumatic. And so I think with your antenatal preparation, whoever you have your antenatal classes with, is to think about what would happen if. Because then you can prepare yourself, and even with an emergency cesarean, and we call it emergency because it's an unplanned cesarean, but even with those procedures, you still have the ability to be in control of a lot of that. You can ask to have the room quiet. You can still request skin to skin if everything's okay with baby. So there's still a lot of things that you can do, and you can still have a beautiful birth experience. And I think for me it's not all natural, because I think when we need intervention, thank God we've got it, and it's wonderful that it's there. But to roll with what's happening, right? To be flexible and to really just know that the first thing that you want to know is, am I safe and is my baby safe? You know, and for partners, that's their biggest concern. And to know that when medical intervention is needed, as I say, thankfully we've got that.
Absolutely. So I think the key is to get only those interventions whenever really needed, and not unnecessarily. And you and me, we truly know and believe that way more women out there should have really beautiful birth experiences. That is currently happening, and the key is really also in women's own hands, big time. So good birth is in a woman's hand, and that's, I think, why we're so into empowering women and helping them understand how it all works, their bodies, their minds, and so forth. And then to find the right providers that can facilitate that process beautifully, right?
So important.
Yeah. So what advice would you like to give women out there listening to us?
So I think follow your instincts. I think for most women, we have this innate knowledge that our bodies can do it. And then kind of all the other messaging overrides that. Then you're like, oh no, okay, I'm scared and I don't want to do this. I think for me, the one key thing to remember is, if you've done the preparation, because that's obviously key, is find a provider that the course material is not just what do I pack in my baby bag. It's about addressing your fears. It's about talking through what happens through the birth process, what hormones are released to support us through this process. Because everything happens perfectly, and I always say it's a bit like a child losing a tooth. If I have to pull it out when it's not ready, of course it's going to be painful. But a child losing a tooth is one of those physiological processes that nature just takes care of, right? The other tooth pushes the milk tooth out and it falls out. And I know I'm making birth a little bit, more simplistic than maybe it should be, but that's kind of what happens is through the natural birth, if we let our hormones get to the levels that they need to get to, this process is just so inbuilt in us. So I think for me, it's trusting your instincts, finding the right person to give you the right information. So it's about preparing yourself really well. And then I think to remember that, I love this saying, is like what gets babies in, gets babies out. And we often don't remember that in a birthing experience. So, Margriet, I mean, you know this very well, is when women are feeling safe in their space, they can birth there. If it's in a room where there's constantly people coming in and out, it just isn't conducive. And so even in a hospital environment, you can request that it's only the midwife that's there with you, that it's quiet, that it's dimly lit. You know, what gets babies in will get them out.
That's the rule,
yes,
correct. Yeah, so that I like that you say that way, because it can really happen in hospitals as well.
Right.
Because it's not for all women an option to have a home birth or... so yeah, create your space where you are.
Yes.
Yes.
And what's nice is to know that you can, that hospital room for that time is your room.
Yes.
So take fairy lights that are battery operated, because they won't, obviously, maybe sometimes always let you plug things in, but you can't take open flames.
Only if you have fairy lights when you make babies, though. I'm just joking.
That's true, if that's your thing. But you can take fairy lights, you can take your own pillow. You can,
right.
You know, I think most hospitals now, that's what they want. They want you to have a good birth experience. And so creating that beautiful space, I mean, you don't want to come with a lorry full of stuff, but, you know, just one or two things that are your own, that are personal. A playlist, you know, just off somebody's phone is so easy. Music that makes you relax and that feels good is, all of these things.
Exactly. So really great tips. For antenatal education, a podcast is really too short, but I hope that women listening are inspired to go find good education and find the right provider, as Sinead was saying, that really understands it and give you the stuff.
And I mean, I know I'm obviously talking to you, but the Sister Lillian Centre has got a wonderful antenatal program that I know you guys are launching. So, you know, I'm a little bit biased because I know that the information that you give is valuable. But for anybody out there that's looking for an antenatal class, interview the midwife that's going to do that and see what the program is. You know, is it going to address your fears? Is it going to help you understand the birth process better? And if the answers to those are yes, that's who you should go with, you know.
Yeah.
So,
yeah. Thanks for pointing that one out. So we've worked on a beautiful antenatal course. We've redone it, so it's refreshed, and in the 4 main languages in South Africa: Afrikaans, English, Zulu, Sotho, and Xhosa. So that's extremely exciting. And we are also having quite a lot of midwives on our websites that we all trust, that you can ask for good education that understands what we are all about. Absolutely. So that's a good start if you are looking. Thanks, Sinead.
Thank you.
Thanks for being here with us today and for what you're doing for mums out there.
No, and thank you very much, because I think the Sister Lillian Centre and Sensitive Midwifery, all of it is just like, the more people who tell women that they can have a beautiful birth, I think, can you imagine how different our society would be? Yeah.
Absolutely. Yeah. It matters how we are birthed.
Absolutely. Absolutely.
Thank you so much.
Thank you, Margriet.
So thank you for tuning in, and hope you enjoy that, and go find that good antenatal educator. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.